I'm here, managing digital editor at Ms., and I'm back at the National Sexual Assault Conference with Christina Presenti and Diane Daiber from the International Association of Forensic Nurses. I did it, right? I said it all correctly. Yeah, and I'm very excited to talk to you all. And I thought I was really fascinated when you reached out to me to learn about the organization and the work you all do. So I would love if you could just sort of give us a quick primer on what the association does and what brings y'all to the conference this year.
Well, the International Association of Forensic Nurses is a membership organization, and we support forensic nurses, frontline, the ones that are on the ground doing the work, and we also support research in sexual violence and in the care of patients who've experienced all different forms of violence. Education is a big piece of what we do. So educating nurses to become forensic nurse examiners and helping them with clinical, as well as like presenting at conferences. Is there anything else you want?
We do so much. We could probably talk about it all day, so maybe we'll get to some of it with some of your other questions. But I think we're definitely a leader in this space, and we are really committed to developing the protocols around sexual assault and making sure that best practices are helping all of the country. And we are an international group, which is really exciting for us. So we actually leverage these resources around the world and bring people together to talk about the way they're treating victims of sexual assault predominantly, but victims of other crimes as well in a medical setting.
Totally. And I know that y'all had submitted a piece to the digital series about sort of going beyond thinking of the role of a nurse in caring for a survivor, like going beyond the rape. And I'm just curious, I guess, what would you define as the full spectrum of what nurses have the potential impact that forensic nurses can have for a survivor on maybe changing the trajectory of their experience and providing them with that comprehensive care?
It's huge. So I actually have an advocacy background, and there's a lot of research on victims of forensic abuse. So the first person that can get contact with and the way that they're treated, or whether or not they're treated, just how that person responds to them, has a huge impact on their long-term health outcomes. So the medical provider providing the care and the way they respond to them, whether they're scared or not, or if they in any way kind of create an unsafe situation for that person, whether it's based on the nuances of the assault or who the person is or how they identify, can have long-term health implications for that person. So I think that's first and foremost, and then Diane can talk a little bit about care beyond evidence collection.
Yeah, I mean, I really think the role of that forensic nurse is to provide that comprehensive care, to start that healing process from the minute you say hello. So, and it's about what that patient wants. We call them patients because we're nurses. They might be survivors to others, victims to others, but it's the same individual. And so we want to help their healing process end. Because we're specially trained, we can handle all the medical needs that they have, including the evidence collection piece. But there's just so much more involved. They think about STD,
Yeah, and I mean, some of the workshops that you all have this year at the conference also include things like how to make sure that nurses are equipped, right, to provide care to survivors from all different kinds of backgrounds and gender identities. What are some of the gaps that you see right now in the field that that you are hopeful you can empower nurses to fill?
I would say the one this morning that we did here at the transgender patient, that is a large gap for healthcare. I think they're just not informed appropriately, and I also feel like healthcare needs to understand a little bit more about trafficking, and not just sex trafficking, but also labor trafficking of the patients that are coming in through the ER. We're seeing them all the time in the ER, just not having the knowledge to ask the right questions.
And we did a presentation this morning on billing for the sexual assault exam, which sounds riveting, but there's a lot of problems there, and I think forensic nurses are in a really unique position to identify the different players and to close some of the gaps in making sure that victims aren't billed for things that they should have.
Totally. And I mean, one of the sort of overarching questions that I had was what would you say is currently maybe wrong with the way that the healthcare system is looking at or creating processes around sexual assault, care for survivors? And then what do you think are some areas where maybe nurses have some instructive knowledge that advocates would do well to learn from? Like what are the ways in which the system is working? What are the ways in which the system's maybe not working? That was sort of what I thought about when I saw the billing workshop. I was like, well, looks like the healthcare system is not working in this one regard. If you're getting billed, and that creates an access obstacle as well. Is that fear of being billed, right? So yeah, what would you say are some of those areas where there are challenges, and then where there have been a lot of successes?
It's an interesting question, because I think locally the answer to that would be really different, right? So as national care providers, we're really aware of who the transnationally, which is billing. So we wrote a grant, or there's a grant opportunity around that. So now we're able to really focus on helping solve that problem, right? Locally, some programs some communities do a great job. If they have a problem, they identify it, and they work together to take solutions, right? So I think to say, like, anything categorically is a problem might not be, correct, or might not actually work with the programs that are doing things. I think obviously there's always areas where people are kind of and one of those big things really is just knowing about the services that are available to them, accessing those services. We know people in rural communities don't always have insurance locally, or they can't get there because they might not have a car, they might not have funds. If it's someone in their family, particularly maybe tribal communities, you might have to, there's one car in a large area where the parents are. So there's a lot of things like that that really are systematic that communities maybe have to deal with more, but getting to healthcare when they need it is a real challenge.
And I'll add, as far as you asked what healthcare is doing well, and again, in some spots they're doing a great job in identifying the need for the forensic nurse examiner who sees not only sexual violence, but other forms of violence as well, and they're being incorporated into the response in their entire hospital system, their entire community, which is only going to make a healthier community all the way around. But more of what we see is not supporting and staffing and resourcing this specialty care of nursing, forensic nursing, that needs to be resourced and staffed like other specialty cares in the healthcare setting. Because we know through research there's so many long-term healthcare consequences from all these different forms of violence. And so these folks are going to come back to our health system and use resources with these other chronic diseases that are going to result from their violence.
Yeah, and what are some of the best practices or maybe models that you all have seen in the field that, do you think there's room there for those best practices to become sort of a standard of care through policy? Do you think there's a way in which advocacy comes back in a way that, there's structures that we've seen working, maybe we should make those the default structures or the default systems?
Well, including advocacy would be great. First of all, I think stepping up and having actual full-time employees in a forensic nursing program is key. And then if you can incorporate a specially trained advocacy for that group that's there consistently, or coordinating if you live in a community that has a really strong advocacy center, that's also great. There's a lot of more rural communities that don't have.
Yeah, and I think we in the anti-gender-based violence movement, we have a lot of best practices, and we know what they are. I think implementing them with our other challenges around sustainability or high turnover in our field, and I think for nurses, particularly scenes, it's the same thing. For organizations that you're part of, or supporting you, or if you're not connected to a membership organization like IFN, you might be the only person in a hospital or in a geographic area, and you're really carrying a lot of work, right? And so for advocacy, it's very similar. But yeah, so I think there's a lot that we can do around sustainability, around turnover, around just implementing best practices. I think when we all agree that we don't really have to question them, when they go and they receive medical care, it's not about necessarily agreeing with results or not. It's not the medical provider's place to be asked this question. The medical provider's place is to say, what happened to you? How do I treat you? What are your medical concerns?
Yeah.
And so there's just Like, we know a lot of best practices, and when we implement those, we don't necessarily need to invent new ones. We know what we should be doing, so let's get there first.
Yeah. Well, and the theme of the conference is Beyond the Breakthrough, and the breakthrough is the Me Too movement, right? And what has that looked like in this sort of direct service work in nursing? Like, what has been the impact of Me Too for forensic nurses, for the care system, as this sort of rush of folks came forward and as these conversations really opened up? What did you all see sort of unfolding?
I think I'm seeing more people reporting, right? So that does mean more people reporting to hospitals. That does also mean more people talking to the media and holding systems that aren't doing a good job accountable. People now know they can call the newspaper and say, I'm being billed for it. And there is more conversation, and so there's more room for support or to identify support and really hold programs accountable in a way that never happened before. So I think that Beyond the Breakthrough is that conversation that's ongoing, and we will continue to see the results of this tipping point and the results of us talking about the problems in a way that people, I think, have done what ears on right now. It's huge ears, and they're really listening in a way that they've never heard survivors before. So that, I think, long term for healthcare and for a lot of other areas, we'll have hopefully like these really cool outcomes for other survivors now and in the future that I don't even think we can quantify necessarily today, but I think there's a lot of listening that we're doing differently, and survivors just have a voice that they never had before.
Yeah. Well, and I guess in terms of, you spoke earlier about how pivotal that interaction with that relationship between a forensic nurse and a survivor could be, right, to their entire experience and to their healing process. What reverberations, like what impact do you know from doing this work, from being engaged with nurses, with patients? What do you know the impacts can be of sort of a good process that is survivor-centered and trauma-sensitive? Like, what does that look like, and what sort of shift does that maybe help push?
Yeah, well, I'm just thinking in my head some clinical examples, but if you have a good interaction, you can see a healthier person, a healthier individual. And if you think about it like a stroke, like this person will have the least amount of deficits remaining if everything works well. If this is a great exam, you've got a great rapport, and you've started this healing process with this patient, so they'll be left with the least amount of deficits and be able to move forward in their world.
Recently, there's a couple new reports about the long-term costs of sexual assault, right? So we know about the people can have a lot of adverse reactions, like increased incidence of diabetes or increased obesity, like NASA's study, right? So those are things that we've known for a very long time, but they're now doing financial costs. I think there was a federal, and then California also looked at it for their state. So we're seeing people are now taking this issue serious, and they actually can quantify now the long-term cost of that ongoing health care and the long-term cost to employers with missed days of work because of a variety of things. So it's an interesting place. Again, we have another tool that hopefully people are aware of and reading, particularly in this moment of Me Too, to help us continue to make this breakthrough really, take root and move forward in a very different way. With, we know that when survivors get the care they need, they get the resources they need, they get the follow-up care, that all of those adverse reactions, and obviously for every individual it's a little different. We all have our individual peculiarities, but all those really decrease when they are connected with people in an appropriate, safe way.
Yeah. Well, thank you both so much. Yeah. I think those were all the questions I had for you. Thank you.
Yeah, thanks so much.
Yeah, for all the work you're doing. And I will definitely, we'll have a link in the video bio so that you all can connect. And if you are a forensic nurse, you can join and get active. Yeah. And help push it beyond the breakthrough. So thank you so much.
Thank you.
Thanks.